You are listening to a SANE Sustainability Education Project podcast. This podcast comes from a portion of the SANE Sustainability 6-week online course that was offered by the International Association of Forensic Nurses and the National Sexual Violence Resource Center. This course highlights ways in which to cultivate leadership and build a successful, sustainable SANE program with presenter Laura Rogers, who is the Director of Emergency Services, Urgent Care Clinic, and Memorial Star Transport at Memorial Hospital in Colorado Springs, Colorado.
I think we're going to give you a couple hints on how to really make your program the best it can be in the environment wherever you are. So really what we're talking about is making the argument for a complete program in your hospital systems. The base of making this most successful is understanding you have to have a culture shift. And when we moved away from us being viewed as just a law enforcement role to absolutely now something that is viewed as medical care for the victim of violence, medical and nursing care specifically, I think that's where we saw the most development of recognition from our leadership and development of that program. So what I'm going to ask you to do when you're designing your program, really do a solid assessment of where you are now. Because in all the lean work that we've said is recognizing your current area where you're working right at the moment. What does your vision look like to go to the future? What is your ideal program? And I think we all have ideas of what that program would be. But then writing it down, taking a look at it, and then really determining what will it take for me to get there as a leader in my program. This is just what the lean process does. Develop an A3 as a terminology if you're looking at lean. To develop an A3 of your program and look at, with a SWOT analysis, what are your strengths of the program? What are your weaknesses? What opportunities can I capitalize on? And then, of course, the last box in any SWOT analysis is what are the threats to the program? And I think the main threat we're all going to really find as we move forward is justification of our most expensive element, and that's our personnel. So how do we get the leadership in your hospital to recognize you as integral to the patient care of this unique population? To do that, I think we look to Studer, and the 5 pillars that Studer talks about in all of his work are service, quality, financial, people, and growth. And how does that look with the SANE group? Let's take a look at those. Well, service is how are you meeting the patient, the staff, and the law enforcement satisfaction. You need to understand what your product is, and your product is absolutely the nursing care you're providing a patient that comes through your door. Your delivery in this challenging moment is truly the element that you have to take a look at. You can go to the leadership and ask them for great growth in your program, but you really need to look at the quality of your program delivery, your product, your nursing care. Be very, very good. It may not be that you will be able to have a full in-house 24/7 program. We didn't to start with either. But what we worked on, I believe, certainly starting with the goals that we have, is that we are going to give the absolute best quality of care that this patient needs and is being provided by our team. Know your product, your delivery, and how you're doing it. Refine that delivery. And you refine that by, is this delivered in the most caring, time-efficient, quality delivery of care that you should be working on? And work on those elements. That's all part of the service. Your QI or PI program is the hallmark of this, and really doing 100% review so that you know you're doing well. And then ask all elements. One of the things we have worked on in the last year and a half or 2 years is closing the feedback loop with the law enforcement group and the court group. How are we performing in our role? Are we actually making your process better, or are we finding that maybe we need a little work on delivering in the court system? Is our product, nursing care of these patients, understandable to your group? And closing that loop. And then, of course, publish your findings. Get the team talking about your delivery of care. Recognize that Memorial Health System in Colorado Springs is getting known as a place where sexual assault and assault of the victim of violence is someplace that is doing it and doing it very well. You're starting the science. You're capitalizing on what other people have already developed and moving forward. What is the reputation of your program? And this goes back to the quality of the care delivery. Do you have the best staff performing those elements? I have to say that the sexual assault nurse examiners are absolutely unique people who have wonderful qualities in the caring world, and yet being able to step back. Are you measuring your quality in a way as how are your staff coming across? Pick the best people. If you have the right people there, they sell your product. How do your staff interact with the community and the partners? How are they interacting with the law enforcement personnel or the district attorneys or the city attorneys that you work with? Are they collaborative in where they're going, but are still maintaining standards of practice? Because this is a balance. Sometimes law enforcement or the attorney's office will be asking questions. You really are, your product is your nursing care. Stand behind it. It is really all about delivering the highest patient care. If you get that right, you will be recognized as the people who make this better. Financial, and here's the big bump. In the current world in which we have to always worry about finances and being able to provide health care in a diminishing return on investment, you have to be smart about the finances. Identify what you provide in services and what it brings for people. Be able to talk about reimbursement. Are there other opportunities for reimbursement? Are there victims assistance programs? You suddenly are in a realm that you may not know this knowledge right now, but this is understanding your product and what you deliver to patients that the organization needs to know about. This is medical care. Medical care costs money, and you need to be able to talk this through so that when your senior leadership team comes to you and asks about, well, you're costing us money, that you can translate that into the following. Make the argument if the best patient care for a stroke patient coming in is getting an evaluation, an NIH score, and that's what the standard is, then we need to establish the same standard for the victim of sexual assault. And I think when you put it into the framework of pure medical care, and again, changing your culture to say, I'm not just collecting evidence, but I'm providing medical care for this patient, that's where we all win, most of all, the patient. Recognize when you're talking to senior leadership and making a sort of an argument for a 24/7, you need to look at what's the return on investment for your organization. And I think you need to talk about the people that are there. It is not just an ED nurse we're talking about. We're talking about an expanded practice role for these nurses. It's a higher quality of care than the regular ED nurse out there. We've moved beyond taking the clipboard and just collecting the evidence. We are now delivering a specialized medical care for a patient, just like stroke, just like heart attack. Keep it at that level in which we are providing a special care. You must remain an expert in this field, just like we go to ACLS for cardiac care. This will become a standard in the future, that people are going to be certified in the care of the victim of abuse. Recognize cost in maintaining that skill set. So if you're managing a department, at the beginning of the year when you're looking at budget, you have to look at what is accountable to maintain skill sets for everyone. How many people need ACLS? How many people need those specialized testing and skill sets? Include the same nurses in there, included at the beginning of your budget. We need to retain people. We need to bring people in, train them, take care of them, and then fund them appropriately. Growth. You have to be able to talk your program. Know the number of patients you're seeing, know the reimbursement rates and mechanism, and know the cost of 24/7 coverage. When you're looking at that, the most expensive thing on a program is personnel. And expansion is the key put the hat on a senior leadership team member. And when you're talking to that member, they have a lot of challenges right now in making a whole hospital system remain in the black. Understand that, argue at their level. And arguing at that level is pure quality, and quality of patient care delivered to a specialized population. It may be that you need to look at when patients are coming in and staff as you expand. What else can this SANE nurse be doing? Understand that personnel, like I say, are the highest cost for any organization, so support that. Generally, here's my suggestion for you. Have an elevator speech always available. Be able to have every member of your team, if you've got 30 seconds or less in an elevator with a senior leadership, be able to talk your product. Do put the hat on of the senior leadership team and recognize the challenges the leadership is having with finances. This is just a given. Get community partners to sing your praises. And I will say that one of the highlights of my 2 years was when the district attorney stood in front of the cameras and said, do not touch that forensic nurse examiner program at Memorial Hospital when you elect to lease. They are integral to us and our success in our whole program. Boy, did the senior leadership team take note at that point. We wouldn't have gotten there if we hadn't worked way back on the quality of care delivered this team. Get community partners to sing your praises. Are you active in the community with those elements that serve this special population? And get your good work published. Engage marketing at your hospital and highlight those successes. The programs are great press programs, so get with your newspaper to highlight those issues also. In the end, put the right people in the positions, work on the quality of your product, be the best you can be, and know your population and constantly improve.
This project was supported by grant number 2011 TAAX-K077, awarded by the Office on Violence Against Women, U.S. Department of Justice. The opinions, findings, conclusions, and recommendations expressed in this course are those of the author and do not necessarily reflect the views of the Office on Violence Against Women, U.S. Department of Justice. This podcast is also part of the SANE Sustainability Education Project mobile app, which is designed for sexual assault nurse examiner program managers. The app helps program managers learn more about program sustainability and provides practical tools to use in their daily operations. It was launched in 2014 by the International Association of Forensic Nurses and the National Sexual Violence Resource Center, based on best practices from almost a decade of training and technical assistance in this area. To learn more about the SANE Sustainability Education Project, visit www.nsvrc.org.